In here, Nina, thanks for that. This is Tyler here. One of the things that I wanted to just mention on this live Facebook was just sort of setting the context for everyone so that you are clear on what is going on and there's no illusions on what's happening right now. You are on the front line. What we've continued to say to government is that their responsibility from the federal and the provincial government is to make you whole. Charlene mentioned that in her opening comments. I'm just going to reiterate that. There's the past few weeks, what we've realized and what we've heard, and just so folks know, is we have redeployed many of our staff to reach out to our members who have been impacted by COVID or who are working at COVID impacted facility. And we've been talking to hundreds of members over the last 2 weeks. And what we've heard is members are losing right now. And what we've done with that information is we've kicked that up to the federal government. We've kicked that up to the provincial government. We've talked to them about home care workers who aren't covered under the emergency benefits program that need to be covered because they're losing hours even though they're ready and willing to work. We've talked to them about long-term care members who have to choose one facility because that started in the past. So we've been pretty clear that the government needs to implement financial supports for this to happen. So we heard today that with this new order that the employers have been given resources to ensure that members are kept whole. So we're going to see if that happens, or we're going to hold them to account. So the illusion is what you hear on those press conferences from the premier and others. We know that's not the real situation on the front lines. Just last week, we heard the Minister of Health say that no workers were interested, or she didn't hear anything about workers being interested in premium or hazard pay. Well, we know that's a lie. We've been hearing clear, loudly that our members are interested in that. And so we've put that on the table. We've been pushing them to implement a system-wide premium pay for our members who are working through this pandemic. And so as Charlene mentioned, we're going to continue to push that. We believe that there's a moment here to standardize that right across the board. So no matter if you work in home care or long-term care or the hospital, or if you're a DSW in the community, there should be some compensation for the work to help with this pandemic. The pat on the backs, that's like yesterday. We don't need any more pat on the back. So we've been crystal clear with government that the time for thanks is over with. We got to see some action. So we're going to continue to do that. So I just wanted to be clear that we're fighting every day to ensure that this government, both federal and the provincial government, is implementing something to ensure financial supports are there for frontline members. On the issue of like hazard pay, look, some employers have taken the initiative to do it already. We have a list of many of them have stepped up and done it on their own accord, but there are many, and the majority of them haven't. And for the most part, we're talking about profitable, healthy, profitable organizations that have taken taxpayers' dollars and put it into profits. And so what we are demanding is the government to direct, not guide. There's no more guidance needed here. Direct these employers to move some of their profits to ensuring members are kept whole through this pandemic. And so we're going to continue to do that. So sometimes when you see those press conferences on the news every day and they're touting all of these great things that they're doing, we know that's not trickling down to the front lines. And so one of the things that I would just point you to is we just launched a public campaign yesterday. We want everyone in the province of Ontario to participate, our members, your families, your friends. So whoever you know that's part of your network, share that information with them, because the more we get folks to participate, the better it is, the better we can make change and influence at the provincial and the federal level. So look out for those We've already launched that on our Facebook. We launched it on our website. So after this Facebook Live, go there, fill it out, share it with your friends, families, and folks in your network. That's extremely important for folks to do. So here's what I wanted to also say. Um, Last week, we the officers held an emergency um, call with the executive board, and we've been thinking, quite frankly, on we are sick and tired of this government inaction, and so what can we do as a union to support our members in a direct way on the front line? I will say, like I said before, we've redeployed a bunch of staff. Your union reps are still working, so the office is still open. We've dedicated new lines to the member resource center for members that need additional supports while they're going through the pandemic. But on top of that, we thought we wanted to do something more. And so that something more is we've implemented, and thank you to our local executive board and the other officers, we've implemented a one-time financial assistance for all of our members who have been affected by this COVID pandemic that you can access. And so we're going to be launching that tomorrow. So full details on who's eligible to apply, what the criteria is, and how you apply is going to be sent out. So look for that on Facebook and on our website tomorrow, probably in and around noon time. We'll have that ready and loaded for you. So that's one thing that we're doing as a union, as leaders of your union, to ensure that we support our frontline members outside of what we're doing to push government to do the right thing. So the second thing I would say, and we made the decision last week, is we've ordered 30,000 masks for our frontline members. Now, they're not N95 masks, they're not surgical masks, but these are masks that you can use when you're out in the community, going for groceries, or doing your daily living outside of work, that you can use as protection as well. And so we're gonna be providing that right across the province with all of our sectors. We have staff that are gonna be delivering them to our frontline members in various units. So look out for that, be aware. We're gonna be in contact with our steward body over the next little while. I believe the first order will be coming in this Friday. So early next week, we'll be distributing those masks out to our members on the front line. So those are two things concretely that your union is doing to ensure, one, that we have an ability to help our members financially, and then two, we've ordered some masks to help keep you safe while you're, whether you're doing your groceries or you're out in the community for the essentials. And so I would just say, your officers are hard at work. The government's responsibility and your employer's responsibility is to keep you safe. A lot of places aren't doing that. We know that, and we're going to fight to ensure that happens. But just know that your union is doing a couple of things here in the short term to make sure we do our part.
Thank you, Tyler. Hi, everybody. I'm Jackie Walker, your nursing division president. And I'm wondering if you folks who are listening on the line right now are as angry as some of the folks that I've been talking to, and angry as me. When I heard Ford today talk about the availability of PPE and his ability to get it into your hand within 24 hours, made me really angry, because I know that's not the reality that you are experiencing as frontline workers. I get angry because the government has dragged their feet on the SARS coronavirus since it surfaced, and they're not taking the action that you need to protect you and make you safe. I'm not interested, and I hear this from some of the folks I've been talking to, not interested in hearing our government say that they're heartbroken because people have to choose between paying their bills and buying food and, being at risk of impacting your family. I am sick of it, and I'm angry. And I know that when I'm angry, I need to do something about it. And I want to let you all, have some self-compassion with yourself and know you have the right to be mad. Your union has been advocating and sending communications to the government and the employers with directives on the use of the precautionary principle to make sure that your clinical judgment and experience is used when you're asking for more PPE to keep you safe. We will not stop pushing the government, and we will continue to look for alternatives and innovate different use of the PPE and make sure that single-use PPE is what it's called, single use. We will not accept the government or any employer's processes for decontamination of PPE that is not scientific. And in fact, everything that's out there that we have looked at so far as the union, the staff of the union, been contacting our international union and their resources and experts from across the world, there has not been a safe way to decontaminate PPE, and we will continue to send that message to the government and to every employer who tries to make this practice. We know you've been trained in infection prevention control, and we want to make sure that support you in standing up and let you know that enough is enough, and we'll stand up to any government bureaucrat, any elected official, and let them know that it's unsafe and it's unproven and that it's got to stop. I was talking to a member who was so mad the other day that she said, "What can I do?" She had heard about a member who, had nowhere to go and was at risk of infecting family because she had been in contact with a COVID patient. So this member reached out to her local hotel and to her employer and made sure that this was something that the employer would take responsibility for before the government told them to, before the government released money to. So I want to encourage you all, if you're mad, do something about it. What can you do? Well, you could call the Premier. The Premier's office is open from 9 a.m. to 9 p.m. And if you're mad about the lack of PPE and the lack of communication that you have had with your employer and the mixed messages, call the Premier. The number is 416-325-1941, and we'll put it in the chat for you too. That's processes for decontamination of PPE that is not scientific, and in fact, everything that's out there that we have looked at so far as the union, the staff of the union, been contacting our international union and their resources and experts from across the world, there has not been a safe way to decontaminate PPE, and we will continue to send that message to the government and to every employer who tries to make this practice. We know you've been trained in infection prevention control, and we want to make sure that support you in standing up and let you know that enough is enough, and we'll stand up to any government bureaucrat, any elected official, and let them know that it's unsafe and it's unproven and that it's got to stop. I was talking to a member who was so mad the other day that she said, "What can I do?" She had heard about a member who, had nowhere to go and was at risk of infecting family because she had been in contact with a COVID patient. So this member reached out to her local hotel and to her employer and made sure that this was something that the employer would take responsibility for before the government told them to, before the government released money to. So I want to encourage you all, if you're mad, do something about it. What can you do? Well, you could call the Premier. The Premier's office is open from 9 a.m. to 9 p.m. And if you're mad about the lack of PPE and the lack of communication that you have had with your employer and the mixed messages, call the Premier. The number is 416-325-1941, and we'll put it in the chat for you too. That's the Premier's office number. There's also the constituency number. It's 416-745-2859. Call the Premier. You can also do what Tyler encouraged you to do. Get onto our resource page and send a letter to the government. And also, get your family, have one-on-one conversations with family, friends, people on Facebook, and encourage them to do the same thing so that our voice can be louder. There's also a survey on our website around long-term care. If you're a long-term care worker, we're asking you to share this with your coworkers. It was emailed out, but you can find it on the SEIU website. We want to collect this data so that at the end of COVID, when we're done, we can have the data to present to government and show them the system. This is definitely a systemic problem, and it's your voice and your experiences that can help us address it. Finally, you would have received an email from SEIU Healthcare on a COVID-19 survey. This is about health and safety. This is about your mental stability, your ability to find balance at work and home. And we encourage you to do this too. These are all ways that you can tap in and make sure that you're doing something to build towards solutions. Right now, I think what we're going to do is take some questions.
Yeah, so the first question I have here is from Michelle. The question is, are we going to get any financial help for hours that have been lost? And so the short answer, and I'm assuming you work in home care, Michelle, if not maybe a community care worker. But the short answer is no. Today's order to choose one job is going to impact a lot of long-term care and home care members specifically. It might impact other members, but those are the dominant members that it's going to impact. And as I mentioned earlier, we've been able to highlight the gap that exists in the emergency response benefit that the federal government rolled out a couple weeks ago, to say that there are many workers that are missing from the benefit. What we're going to continue to do, and you heard the Prime Minister a few days ago come out and recognize that. And so they've committed that they're working on something. We haven't heard what that something is yet. So we're going to continue to push that every day, every time. You know, Charlene's on many calls with the government. They're reaching out. And so we're going to continue to make sure that that is not missed. So hopefully we're going to cross our fingers to make sure that is put in place soon, so that that's addressed, because we know the financial loss that our members are experiencing is extremely painful right now. And so we are hoping that the government is going to do the right thing. The other question that I wanted to just answer and address, and it came from a member. I don't recall the name. I don't have it in front of me, but I remember it because I read it earlier. Was around the comment on being blamed for the spreading of the COVID crisis in long-term care and home care. This is not your fault, right? This is not your fault. And so the media is reporting one thing, government is saying another thing, but this is not your fault as a frontline healthcare worker. The fault lies in the government's inability to ensure that these employers are protecting their workers. Your employer's job and responsibility is to protect you at all times. That's what you sign up for. You sign up to deliver a service. You sign up to work at a facility, knowing that you have the comfort to go to work and feel safe. And when that doesn't happen, that's their responsibility. So for folks that are feeling guilty about maybe you spread it, or maybe you're feeling guilty about the situation, don't feel guilty at all. This is not on you. So I just wanted to say that so that folks don't feel like this is on you as a healthcare worker. You are doing an amazing job out there, and you need to be recognized for that. But it's not your fault in terms of how this COVID virus has been spreading across the healthcare system. Jackie, you want to take that?
Here, I'll take the question that came from the Facebook questions right now. It comes from Sarah. It says, I heard union contracts are void because management is taking away holidays. Is this true? The state of emergency, Sarah, and everybody listening, it did give the guidance to employers to do what you got to do outside of the collective agreement. We've heard and we've worked with some members who are having their shifts change from 8-hour shifts to 12-hour shifts, having folks being redeployed in different areas. But this is something that we have made echo loud and clear to the government, that this lack of directive and this free-for-all that the government has created with their state of emergency has caused the employers to resist communicating with the union. We've written letters from our lawyers. We have on a regular basis, are your service reps, your reps emailing very pointed emails to the owners, the CEOs, and so is your contract void? No. Does the employer have the ability right now to um, neglect some of the rights that we fought for? Yes. Are we addressing this with government? Yes. We made it loud and clear to them that this state of emergency has given the employer no accountability to respond or to be in contact with the union. And we let them know that they need to change that yesterday. Tyler?
So before I hand it off to Charlene, I just want to just say one final thought. Let me just be clear again. This government has already demonstrated that they are not working in the best interest of frontline healthcare workers, plain and simple. And you can see it by all of the actions that they've demonstrated to this point. Case in point, first thing, what do they do? Instead of providing the proper protection or instead of implementing premium pay to recognize the heightened risks that our frontline members are taking on the front line, what do? They strip away your rights as union members. So we just need to be clear that this government is not working in the best interest at this point for our members. So, you know, we just need to remember that and check that when the time comes. So I'll just hand it over to you, Charlene. I know you've got a couple things you want to mention here, but I just wanted to get that point in at the end here because we are working and living in a time where we need leadership at the provincial level, and it's very absent. Regardless of what you see on TV, it's very absent.
Yeah, thank you, Tyler. So I'm looking at all of the Facebook Live questions that are coming in, and some of you are great at answering them, so you can take a look at that. You're right with your answers, that's wonderful. A lot of questions coming in on PPE. It's the number one issue, and the Premier today, every day at 1 o'clock, he gets on TV and says that he's doing everything he can and that his heart's out there for all of you, as he should. But he was asked today about the PPEs that he said he had delivered on the weekend, and we all saw the photo op that he had with the boxes and boxes of PPEs. And he said that those PPEs were to be delivered to every facility within 24 hours of dropping them off. He told reporters that if you know of any homes that aren't getting PPEs delivered, that you are to call him directly. So if you are still experiencing a shortage, which I know you are, do what the Premier asked you to do. Call him and tell him that you are not being provided PPEs, and he's claiming that he will get them to you. But I want to remind you that if you do not feel that you have the proper equipment to go into any room or take care of any patient, client, resident, or clean or serve any kind of a meal, you have the right to point that out to your manager and say that you want the proper PPE. And we've got documents for you that are posted on our website. Don't forget to call the MRC with questions. We've got a lot of assistance, member assistant lines open for you. Everything from WSIB and some mental health support. So don't forget that. The PPEs, again, and I would ask you also to call some of your corporate headquarters. Many of them have said that they're counting on the government. Well, so you know, some of those corporations make billions of dollars a year. So remind them to use some of those profits and put them into the front line and provide you with the proper PPE. A lot of home care questions on here again, and I promise you, every government level I am talking to about addressing home care, for sure. We are looking at the federal government, including you, in the emergency relief benefit. We're still working on that. But let me also remind you that the Minister of Health said that there is the employment portal in the provincial government. So call and put your names in there for jobs. And again, they were saying about the redeployment today that they're going to start redeploying hospital workers into some of these long-term care facilities. So there could be also work available for some of you there. Again, lots of questions on the pick one job. You are going to have to pick one job, and we are continually driving the point to this government, and if they're not listening, I have said it, I think on 6 media interviews today, you need to be kept whole. You need to be paid full time because that's why you're working 2 or 3 jobs. So wherever you choose to work, they need to pay you full time. And the hazard pay, lots of scrutiny on that. There's been some employers that have stepped up, but again, we are negotiating because they tell us we need to negotiate with all of your employers. And maybe now that they know you're going to have to pick one job, they're going to start offering some hazard pay. So we continue to drive that with all of your employers, believe me. And again, our premier gets on the TV every single day and says how important all of you are to you, no matter where you work or what you do in this fight, this COVID fight. So he has made comments like, if he had it his way, he would have given you all a 10% increase, how important you are to them, and he tosses the ball somewhere else. I want to remind you that the premier has the authority to demand and to order your employers to give you hazard pay, to give a universal wage out there, to provide proper PPE, to make sure that you have the staff that you need. If you are off, he has the right to make an order that you get paid to be recovering from home or taking care of vulnerable family members. So the premier has the authority to do that, and I continually demand it from every single platform that I can do it on. And he is to do the same thing. So again, we continue to fight for what you deserve, but I told CTV today that when Premier Ford says that he wants to give you the earnings and the respect and declare you as essential services, Mr. Ford, I'm going to use some receipts when this is all over. And together with all of you, I'm not going to forget these times of trouble, and when you were deemed essential, and when the world counted on you, keep our families and ourselves safe. So this is going to be something that we're going to be fighting for a long time. So please, everybody, stay strong, stay united, stay safe, and don't forget to call the MRC if you have any questions after this, or check the Facebook or website. So take care, everybody. God bless you, and we'll see you next week.
Mainstream media journalists and partisan liberals on Twitter were quick to refute my claim, and many suggested that I was being unfair and that I was wrong. So let's set the record straight, shall we? What rules did Trudeau break? Well, first off, his background. Justin Trudeau has been staying alone at Rideau Cottage, which is a home on the property of 24 Sussex in Ottawa, since March 29th. That is when his wife, Sophie Trudeau, tested negative for coronavirus after previously having the disease. And that's when she and her 3 kids packed up and moved to Harrington Lake, Quebec, the official country residence of the Prime Minister. So, in order for Trudeau to travel to Quebec, to his country residence, to see his family and stay with his family, Trudeau broke the following rules. Number 1, he crossed a provincial boundary and entered Quebec. So after telling Canadians not to travel, after telling Canadians to stay at home, Trudeau himself packed up his bags and headed for his country residence in rural Quebec. He crossed a provincial border into Quebec in order to do that, despite that border being closed. Gatineau police set up checkpoints on interprovincial roadways Wednesday in an unprecedented effort to enforce the province's new ban on non-essential travel into Western Quebec. Now sure, it's only about 35 kilometers between the 2 residents, but Trudeau had to cross a boundary that was closed to other Canadians. Gatineau police said checkpoints were set up at bridges, ferries, and major intersections, and that drivers could be fined up to $6,000 for trying to make non-essential trips. Trudeau and his motorcade were let right through, while other families trying to do the exact same thing were turned away. Number 2, Trudeau went to a cottage. Justin Trudeau's top public health official, Dr. Theresa Tam, has stressed on multiple occasions for Canadians not to travel to their cottage, cabin, camp, or rural home because of the potential strain on healthcare in smaller rural communities. This is a quote from Twitter from Dr. Theresa Tam. COVID time is not cottage time. Stay home and resist the urge to head to the cottage or rural setting. Don't add further strain on communities with less capacity to manage COVID-19. do your part, flatten the curve, plank the curve. So Canadians, you can't go to your cottage. Justin Trudeau, go right ahead. Number 3, Trudeau visited family who don't live with him. Justin Trudeau has told us on many occasions that he lives in one household, Rideau Cottage, and that his family lives in another, Harrington Lake. But according to his government's own rules, they should have celebrated Easter digitally, through social media or through Skype or Zoom. Here are just a handful of the many examples of Trudeau government officials telling Canadians that they cannot visit family members living in other households. This CBC report specifically says, and I quote, "Physical distancing means not interacting with anyone outside of your household, including immediate family members and significant others who don't live with you," unquote. Here are just a handful more Trudeau officials telling Canadians not to do exactly what Justin Trudeau did. Dr. Theresa Tam, the choice of where to be, home, in your bubble, with existing household members only, has never been clearer. Again, Dr. Theresa Tam, now is the critical time to maintain our physical distancing. This means having dinners and celebrating with household members only, and connecting with others virtually over phone, email, and video chat. Dr. Theresa Tam, physical distancing and not being able to gather together is difficult. Thank you for celebrating virtually and at home with members of your household to slow the spread of coronavirus. Deputy Chief Public Health Officer Dr. Howard New, unfortunately, any religious celebrations this year will have to be strictly limited to your existing household members only. Dr. Theresa Tam, this means dinners and celebrations will need to be strictly limited to your existing household members only. So you can't visit your family unless they live in the same household, but those rules don't apply to Trudeau. Number 4, Trudeau's wife Sophie posted photos of Justin Trudeau and his family doing an outdoor Easter egg hunt together after Justin Trudeau had specifically told Canadians not to go outside and specifically to do their Easter egg hunts indoors.
You'll have to stay home. You'll have to Skype that big family dinner. And the Easter egg hunt, well, it'll have to happen around the house instead of around the neighborhood.
And finally, number 5, Justin Trudeau left his house. He went outside and he enjoyed the great outdoors. Just days after telling Canadians the exact opposite, to stay inside, to not leave their homes, and to not go out into public parks this weekend. But you know what? Rules like these are for the little people. Trudeau likes to say we're all in this together, but he doesn't seem willing to follow the same set of rules that he demands that we follow. Perhaps the worst part of all of this is that everyday Canadians are getting ridiculous and exorbitant fines, frankly, for doing far less than what Justin Trudeau himself did. And equally as bad, rather than fielding tough questions from the media and having to answer for his hypocrisy, so many journalists in the mainstream media were falling over themselves to defend Justin Trudeau and to attack me, a journalist, simply for asking the wrong questions. All of these people are doing a disservice to Canada. For True North, I'm Candice Malcolm.
Let me now share about what we know about this novel coronavirus. This virus comes from the family of coronavirus, which includes other viruses such as MERS and SARS, as well as the milder variants causing common cold. The medical consensus at this moment is that the novel coronavirus is more transmissible, but appears less deadly than SARS. Available evidence suggests that the rate of human-to-human transmission of this virus appears to be higher than that of SARS. For now, the evidence also suggests that transmission is mostly via droplets. What this means is that the virus is carried within droplets emitted from an infected person over a short distance, such as when a person coughs or sneezes. If these droplets come into contact with the eyes, nose or mouth of an individual, directly or indirectly through hands that have come into contact with these droplets, the individual may become infected. To clarify, There is no evidence currently to suggest that the virus is airborne. There are other viruses, such as the chickenpox, which can easily be transported via air currents, and do not require droplets to contact the eyes or nose. The novel coronavirus is not in this category of viruses. The novel coronavirus could also transmit through surface contact. Let me explain. When a person sneezes or coughs, the droplets fall onto the surfaces of tables and chairs, for example, and the virus may remain alive for up to a few days. When someone else touches the surfaces of these tables and chairs, the virus can be transferred to his hands, and if he then rubs his eyes or nose without washing his hands, he may become infected. So we should wash our hands. This is also why we only quarantine the close contacts of confirmed cases. For more transient contacts, such as individuals that the confirmed cases may have walked past in malls or hotels, the risk of transmission is low. For coronavirus generally, the person is most infectious when he is displaying symptoms, or what we call symptomatic. And this is likely to be the case for the novel coronavirus as well. The most effective way that we can protect ourselves is to practice good personal hygiene. We should regularly wash our hands with soap and water and avoid touching our face with our hands.
Most families like Cesar had to keep their loved ones' bodies at home for several days after authorities became overwhelmed by the number of dead. To protect against the smell in this tropical city, coffins are wrapped in plastic for a final farewell. While authorities claim fewer than 200 deaths from coronavirus in the whole of Ecuador, the city's morgue was overflowing.
Esta es la realidad.
The mayor has now announced 2 emergency cemeteries in Guayaquil to cope with demand. Despite an early lockdown in February, videos by desperate families show a city in chaos.
Hemos tomado la decisión de enterrarlo.
Corpses kept in houses, on the street, some even abandoned.
Hay que decir la verdad. Sabemos que tanto en números de contagios como de fallecimientos, los registros oficiales se quedan cortos.
The president's
Se quedan cortos.
The president's admission did little to calm the anger here.
Necesitamos la ayuda internacional para que la gente no siga muriéndose.
And as the frustration boils over, inside, the medics are facing an existential crisis. 7 nurses have already died and 147 are infected. Over 100 more resigned due to lack of protective gear and support.
Antes hice un periodo de apnea, que tuve que ir a emergencia para que me pongan oxígeno. ¿Qué están esperando? ¿Que yo me muera?
Petita's husband, Orlando, was sent home from the same hospital after doctors said they had no way to treat him. After he died, his body lay in the living room for 4 days before they could bury him.
Porque es algo que usted nunca espera, porque nos tocó hasta incluso dormir afuera, ahí dormíamos en unas sillas ahí porque el olor era insoportable, no se podía entrar.
Despite the lockdown, authorities say as many as 3,500 people may still die from COVID-19 in this part of Ecuador alone. With vast levels of inequality and little investment in public health, Latin America is ill-equipped to cope with the coronavirus crisis. The fear in this region now is that Guayaquil may only be the beginning.
As of 27th of March, the United States of America has more confirmed cases of COVID-19 than China. The US has exceeded 80,000 cases and officially became #1 in the world. According to the Institute for Health Metrics and Evaluation, if the US doesn't gain control over this pandemic, there will be not enough beds and ventilators for the patients of COVID-19 as soon as the second week of April. And experts say this might result in over 80,000 deaths just in the US within the next few months. That would be horrible, and we need to come together to not let it happen. Let's all look at this objectively and ask, why does the United States have so many cases, and what can we all do to fight this pandemic? Over the past few weeks, Donald Trump has been consistently downplaying the pandemic.
We did one of the great jobs. You say, how's President Trump doing? They go, oh, not good, not good. They have no clue. They don't have any clue.
But why? Some may say it's because of the president's arrogance or even ignorance. But I think it's because of the economy. Because there is no vaccine for the coronavirus recession.
If we lose those companies, we're talking about millions of jobs.
See, coronavirus not only kills the people, but also the country's money. Last week, we saw the biggest jump in unemployment rate in history. This graph shows how big it is just in the United States. Many economists say that COVID-19 is the beginning of a massive spike in unemployment that could result in over 40 million Americans losing their jobs by mid-April. And if 40 million Americans don't have jobs, the panic will rise, the poverty will rise, the crime will rise, and the cases will rise. Because many people will end up on the streets protesting and fighting each other. Donald Trump and his advisors may know it very well, and that's why from the very beginning, to not spread more panic, they've been downplaying the situation. Unfortunately, this downplay strategy was a mistake and a warning to the rest of the world. As the US leads in the amount of confirmed cases, the economy will be much harder to save, and because of the late response to the virus, there are way more cases in the US than if the measures were put in place earlier, like in Singapore, for example. Now, the whole US has to adapt. The response has to be extreme, and all of us need to take it as an example for April. As the danger grows, right now many people target their anger at Donald Trump, at China, or even at each other. Racism grows, hate grows, panic grows. Day by day, the world is becoming more negative and hateful. It became divided into two groups of people, with Group 1 who underestimated the coronavirus, and Group 2 who were scared of it from the very beginning. But please, being divided into two groups will not help us. Let's not focus on the past mistakes, but better on the future solutions. We can fight the virus following the steps that the World Health Organization suggests us. We can win against it with the right awareness. Because unfortunately, there are still people who don't take COVID-19 seriously enough. People who treat it as a joke. People who don't want to stay at home when doctors tell them to do so. There are still countries who downplay this pandemic. Like Bangladesh, which just a few days ago had mass prayers with 25,000 people staying right next to each other. This is dangerous not only to Bangladesh but also to the world. If we don't find a way to unite and understand how serious it is, if we keep on fighting each other, we will all be at equal risk no matter who we are or where we are. Because this virus doesn't care where you're from, what your race is, or how good your country's economy is. Coronavirus only cares to make us sick, but not sick of each other.